on the effects of stretching on range of motion and flexibility after sports injury surgery. The article I found from March 2020 tested this theory on soccer athletes who had just undergone surgery due to an athletic injury. Some background information. So, in the article, they talked about different types of stretching, including ballistic, static, and PNF. Ballistic stretching is an active stretching that uses movement and propulsion to stretch the muscle. Static stretching is when you maintain a stretching position for about 10 to 30 seconds. This is more appropriate after a workout or exercise during a cool down. PNF stretching is a method of accelerating or expanding the neuromuscular mechanism by stimulating deep receptors to relax the muscles. This method is the fastest and most effective form of improving static and passive flexibility. It includes hold and relax, contract and relax, and hold, relax, and contract. So, the introduction, the hypothesis presented is that post-athletic injury surgeries can increase flexibility and range of motion with the assistance of PNF, ballistic, and static stretching. The article states that soccer is a high-risk sport that involves a lot of muscular injuries. The purpose of the study is to determine which technique will best improve range of motion and flexibility after an athletic surgery. Methodology. For this research, the researchers studied soccer athletes for 2 years who undergone surgery at a University Health and Wellness Center. The methods used in this particular study was descriptive and correlational in terms of data collections. There were a total of 97 male participants in the age range of 19 to 30 years old. To evaluate the flexibility of the athletes, they used a goniometer to measure flexibility between the knee and the ankle joints. After the surgery, the subjects went through 2 months of physiotherapy that included stretches from ballistic, static, and PNF. There were tests done before and after the flexibility exercises to help determine the range of motion before these stretches were completed. Data and results. So these two tables here show the mean range of motion before and after the stretching techniques. It can be inferred that there is a difference between stretching post-surgery. The stretching technique that had the biggest significance was the PNF, which had a difference of 10.216, compared to ballistic and static, which only had a difference of 0.233 and 3.7. In general, each technique had a significant effect on flexibility and range of motion. Analysis. Overall, based on the researchers' findings, it can be said that PNF significantly increases range of motion and flexibility after surgery that is related to sports injuries. Static stretching also moderately increases range of motion and flexibility after surgery, but ballistic stretching does not greatly affect it. So the researcher does not really recommend it for post-surgery. So the big concept is which method is best for sports injury surgeries and how can this be beneficial in the real world. So one of my main takeaways from this research is that PNF is very important for post-surgery recovery from sports injuries. This really increases one's flexibility in many ways. The next best thing for stretching would be static stretches. Also, this research only looked into the knee and ankle joints, and I believe that it would also be beneficial in other areas as well. This study not only goes for men, but it goes for women as well. Some real-world applications for this could be using it in other sports and for non-athletes. I believe that this can help non-athletic surgeries as well. This is why patients typically go to therapy after surgery, not only to recover from their surgery, but to help increase the range of motion and flexibility in that injured area. These stretches can also be used before and after a workout to help prevent injuries and to increase range of motion and flexibilities. And again, this could be used in other sports as well, not just soccer. So sports like football and basketball, volleyball, stuff like that, where there are common injuries. These stretches can also be used in PT clinics, physiotherapy clinics, and in schools with sports medicine programs. Athletic trainers can also provide their athletes with different types of PNF and static stretches to help with athletic injuries that do not even require surgery.